So September 25th of 2005, I was involved in a cycling accident, and at that point in time, I foolishly, embarrassingly, ran into the back of a parked vehicle. Lots of rationale behind that, no good excuses. The resulting issue was I ended up as a quadriplegic, had severe neck injury, had subsequent to that excellent care at the scene, excellent care in the emergency room, subsequently surgery, wonderful nursing, absolutely outstanding physical therapy, went through some alternative forms of therapy, including craniosacral therapy, myofascial release type therapy, had fantastic care from the caregivers that were around. Every single person was unbelievable. From the faith and spiritual part, I had prayer groups nationwide. I've even heard stories of some folks internationally. Had visits from clergy that were former patients even. These things were, for me, all integral. I've had a dramatically remarkable recovery that I'm extremely, supremely appreciative of. Been able to return to surgery. That aspect has been, in and of itself, a blessing. In many ways, not just being able to utilize the tools and the gifts that I believe God has provided me, but also to hopefully help others. The key parts of this that I keep asking myself from the initial part, even from the day the onset of the accident, is the usual, why me? Why did this happen to me? And it's now turned into, why me? Why does this happen to me? Albeit from a totally different perspective. I have had recovery when it's atypical. It's unusual. It's not the normal scenario. I've been so incredibly blessed. For what reason? I can't really tell anyone I know that. I just know what is. I know what occurred. I know where I am. I'm extremely appreciative of that. But it's happened for me, and as such, as a scientist as well, I think that there's ways that these things, these good things, can happen for all of us. I think if we integrate the best that we know of in medicine, the best that we know of in rehab, the best that we can do for ourselves in terms of pushing ourselves in our own recovery and therapy, bringing in the spiritual portion of this, bringing in the psychology. In my opinion, healing involves all of these things. It's not one singular dimension. One of the muses in my life has made the statement, healing does not just come at the hands of physicians. Amen. I think there's a great many places that healing occurs in all of us for every type of problem that we have.